Hi everyone, Dr. H here, your source of musculoskeletal care, and I'm going to do another multi-part series. I went into a deep dive regarding the health benefits of strength training, and if you want to see that series, you can click on this up here. And while I do feel that strength training is still one of the most important things that you can do for your overall health, in terms of your day-to-day risk of musculoskeletal damage or injury, posture might even be more important. So in this first video, what I'm going to do is dispel some common myths that I routinely hear from my patients in my own clinic. This video will provide sort of a basic foundation, cover a lot of ground in understanding posture. Then the second video will do a much deeper dive into posturing of the upper body, mainly focusing on the shoulders and the shoulder blades. And finally, in the third video, we're going to shift our focus to the lower body, and there we'll be paying special attention to the pelvis and low back area. So let's talk about all that. So if you somehow found this video, this may not be much of a myth to you, but there are still plenty of people out there who seem to feel that posture is simply just sitting straight or standing up straight. But really that's posture more in a societal or aesthetic sense. Your parents or maybe your grandparents would always bark at you to not slouch or don't hunch over. And this is mainly because slouching and hunching over just looks bad. But the posture we're going to be discussing in these videos is what we call in the musculoskeletal medicine world good joint centration. If you distill it down, a joint really is just the interaction of two bony surfaces. And these surfaces are such that they sort of mirror each other. So if we look at this model here, which we'll be using a lot in the next video, this is a model of the shoulder joint. This is your shoulder blade or scapula. This here is your collarbone or clavicle. And this is part of the humerus or your arm bone. And if you see the head of the humerus here in its rounded shape, that mirrors this fossa here on the shoulder blade. And when you have good joint centration, these line up nicely and move with minimal friction. The problem, though, is if this joint shifts out of being well centered, you then start getting deterioration and wear and tear, usually first of that soft tissue stuff and then eventually of the bony components. And this can lead to joint damage in the future. So joint centration is a concept that doesn't just apply to shoulders. It applies to pretty much all the joints in your body, your knees, your hips, even the very small joints between your vertebrae that make up your spine. And in all of these joints, when we talk about good posture and good biomechanics, what we're talking about is good joint centration. So another common myth is that posture refers mostly to just a static element. So it's how you position yourself when you're seated or how you position yourself when you're standing. However, posture and good joint centration is even probably more important when we're talking about how we move. Sure, you can do a lot of damage just sitting slouched all day long, but where you really risk injury is when you're doing any kind of strenuous or just general motion activities, but you're doing it with this poor posture or poor joint centration. So most impingement issues that you'll see in the shoulder and a lot of them that you'll see in the hip usually come from the fact that that joint isn't properly aligned or not properly postured while we go about doing our day-to-day activities, or particularly if we go about doing anything athletic or strenuous. So while the starting point for postural corrections usually is static, we want to get things properly situated without movement first, the ultimate goal is always to get good posture and good joint centration during movement. Okay, so far everything we've been talking about I think has been fairly intuitive, and if you found this video, you've probably already agreed with most of it. It's right around now that we're going to kind of deviate a bit from what even a lot of other musculoskeletal clinicians are telling people, and certainly what the general public tends to view in terms of posture. So an example that I often hear in my clinic goes something like this. Yeah, doc, I know I have terrible posture. I did all the wrong things in the gym when I was younger. Did way too many bench presses, not enough pulling exercises, and now I have this terrible posture. And the implication here is that they've created this muscle imbalance between the front and back muscles that is now directly contributing to their poor posture. And while it's certainly true that they've likely created a muscle imbalance, it's not true that it's directly causing their poor posture. Contributing for sure, but not a direct cause. Aside from some rare exceptions, your muscles do not force you into any particular posture. They can make it more comfortable or less comfortable to be in certain positions, whether they're good positions or bad positions, but they're not actively forcing you into this posture. You can still self-correct. You can still move yourself into a good posture even in the setting of these muscle imbalances. So this leads to the next very common myth. But just like muscle imbalances don't directly cause postural issues, fixing these imbalances will not automatically fix your posture. In the previous example, the patient felt that their old gym habits had probably shortened up their pecs, which it probably hasn't, and weakened their traps, which it probably has. And the idea is that if they were now to stretch out the pectoral muscles and strengthen their traps, that this would then fix their posture. And while this would certainly help and make it probably more comfortable to be in the correct posture, it will not automatically fix or magically fix their posture. This likely comes from what we can call a sub-myth, which is that strengthening a muscle automatically tightens it or shortens it. So the idea is if my traps are weak and my shoulders are all hunched forward, all I need to do is strengthen my traps and they'll be able to pull my shoulders back and tighten up. But that's not how muscles work. Strengthening a muscle doesn't cause it to just automatically shorten up. In fact, if you look at the study here, strengthening muscles in the long term don't increase stiffness at all, and if anything, sometimes decrease stiffness in the muscles. So while strengthening a muscle can be great and can help fix imbalances, it's not going to automatically reposition or magically reposition your body in a way that it should be for good posture. Now, I cannot emphasize enough, I am absolutely not saying that fixing muscle imbalances isn't a worthwhile thing to do. It's pretty much what I do the most in this clinic. What I'm saying is that even after you fix your muscle imbalances, you still have all the work ahead of you. Posture is a mindfulness game. It is a habit. It is something that you have to do correctly and then maintain correctly over time. Thankfully, just like your body adapted to your poor posturing, it will adapt to your good posturing and it will become more comfortable and it will become more second nature. But it is a habit that you have to actively do on a day-to-day basis. So these next two myths are actually going to be a major part of video 2 and video 3. But just in case anyone is watching and just wants the spark notes, here goes. A myth I hear all the time from patients is that they need to pull their shoulders back and down, or what we would call scapular retraction and depression. And as we'll go into great detail and great length in the next video, this is almost never an appropriate recommendation for patients. Again, we'll talk about why later, but for now just know that this idea of pulling your shoulders back and down, or I often hear putting your shoulder blades into your back pockets, is not only not beneficial, but for a certain set of patients can be detrimental. So this next myth isn't really a myth, as you'll see in the third video. There actually is a good chance, statistically speaking, that you do have a slightly anteriorly tilted pelvis. The myth is that this anteriorly tilted pelvis is somehow going to absolutely destroy your low back, your hips, your knees, whatever. And as we'll go in, again, great detail in the third video, this is just not the case. And in fact, sometimes the things people do to help reverse this perceived problem can cause more harm than good. Once again, we'll go into all of this in the third video, but for now, just know that if someone accuses you of having an anteriorly tilted pelvis, it may not actually be a problem. Okay, so this video was meant to cover a lot of ground. In the next two, we'll look at much more specific elements of posture. So I'll see you then, and in the meantime, keep moving.